I am Dr. Ramona Jackson Jones, Chairman of Douglas County Board of Commissioners. It is my pleasure to welcome you to Clearly, our show on DCTV 23 that has the purpose of bringing information to you about county departments, programs, and people. Information is essential to being able to think clearly. If you have not heard already, WellStar Douglas Hospital is building a new birthing center right here. With the growing demands of expectant mothers in Douglas County, we are excited to share the news that the new facility is expected to open this spring of 2019. Joining me today is Dr. Kevin Ward, the medical director of the new Women's Center at WellStar Douglas. Good evening, Dr. Ward. I'm so proud that you're here today. I'm so excited about our new birthing center here in Douglas County, particularly at the WellStar facility. Can you tell me a little bit about what's going on with this new facility? And just we are so excited that the community is hyped, and I want to not steal your thunder, and I just want you to share with us what's going on.
Yes, ma'am. Well, thank you for having me today. It's definitely an honor to be here. So this has been something that has been many years in the making, long before I even came here. And you know, I started about a year and a half ago, moved from Chicago, and then had heard about we're getting a new birthing center, and then months went by, and I kept wondering, when is it going to come to fruition? And you know, April of this year, that's the day that it opens. So you know, credit to all the administration at the hospital. And WellStar in general, and even the surrounding community. Those are the people that deserve the credit. I just get to enjoy the benefits of it.
Oh, absolutely. Mr. Craig Owens has done a phenomenal job, who's the CEO of WellStar here in Douglas, and we're so proud of what he's doing and his amazing contribution to just the health center, period. We had an opportunity to chat, work with him directly on the certificate of need.
Yes, ma'am.
And I was so proud to be part of that. And he called me with the good news, and I'm telling you, it just blew me away. Healthcare is my background, so you know, I'm very passionate about what's going on there. And you all have, I call it state-of-the-art care, best practice, which is very important to me. Tell me a little bit about your practice. I believe your practice is North Douglas, and you have a team that you partner with. If you could mention their names and tell me a little bit about what you all do and your contribution.
I'm one of the 4 physicians at North Douglas OB-GYN. We have, again, 4 physicians, myself, Dr. Natalie Brathwaite, Dr. Beverly Pottinger-Pickens, and Dr. Marie Colbert. She joined us from Chicago as well just a few months ago. So we welcomed her as a great addition to our team. We also have 2 midwives. The first is Miss Shannon Colvin. She has been here. Everybody that has lived in Douglasville within the last 20 years knows Miss Shannon, and she probably delivered them. She's a vital asset to our team, both clinic and hospital. And then we just got another midwife a couple months ago, Christine Reynolds. She's another asset to our team, and hopefully we've laid the foundation to incorporate more mid-level and providers, including physicians as well. You know, we've been in the same office for decades now, and so it's exciting to be able to not only transition to a different office right across the hall, essentially, but also into a new birthing center all at the same time. We are the only group here in Douglasville that actually delivers babies at the hospital.
Wow.
So it's an honor. For one thing, and it allows us to get to know our patients, you know, better than most, I would say. We're a family, and that's how we practice, and that's how we treat our patients as well.
This, Dr. Ward, this facility, I understand, is 16,850 square feet. I mean, that's huge. I worked in surgery back in the day, and we didn't even have such things as birthing centers.
Right.
Everything was done in the OR, even your C-sections and all that. Now you have the C-sections that'll be moving or transitioning to the new birthing center.
Correct.
So you have a patient-centered approach, which is excellent. Tell me a little bit about this new center
Yeah.
and in terms of all the amenities. I'm so
Oh, yeah.
excited.
We'll have 10 suites,
Wow.
which are the state of the art. You will not find more advanced and private room or suite anywhere, probably in the southeast, much less the country. One of the most amazing things about the new birthing center, outside of the amenities such as the USB ports all over the place for charging your phones, your tablets. We'll have Bluetooth wireless capabilities. We'll allow patients to can labor in the tubs. We're looking into alternative forms of pain medication like nitrous oxide, which is the laughing gas. It's becoming more popular nowadays. So again, just because we're getting something new doesn't mean we're not looking into the future as well. But the most important thing is that we're getting a level 2 NICU. And so that there's 5 individual suites for those babies if needed. And that will allow us to take care of high-risk pregnancies, decrease the chances of a baby that is born at our hospital being transferred to a different hospital for a higher level of medical care. And so that's exciting because a lot of our patients they're close to home, and so to have to separate a mom and a baby after delivery, meaning that if we have to transfer the baby to a different hospital for a higher level of care, that's pretty tough on our patients. And actually, I have personal experience with that because my wife had the same thing. She had our baby at Douglas Hospital a couple months ago, and he was a little stubborn, so he had to be transferred out. But if we had that higher level of nursery, he would have gotten to stay there. So it's what Douglas, the community in Douglas, Douglas County deserves.
Wow. First and foremost, I'm so excited that your baby's doing well.
Yes, ma'am. Thank you.
After he had to be transported to another facility. Unlike myself, I had a high-risk pregnancy, and it was toxic, preeclampsia.
Oh, yes, ma'am.
And back in 1984, unfortunately, they didn't have a neonatal center available in North Carolina. My former husband is a Marine, so of course they thought that they were going to have to ship my baby off to Virginia, but we were able to stabilize her there, and she stayed in North Carolina. So I understand. So this is huge news for me. So exciting. For our high-risk pregnancies, now they don't have to travel. That's so amazing.
Right.
So you will take care of you and your team will take care of them from point A to point B, all
Yes,
the way
ma'am.
through the process, rather than them traveling outside.
Yes, ma'am.
Have you talked to any of your patients and informed them of this exciting opportunity? The ones that are particularly high risk, are they excited about staying here in Douglas?
Absolutely. It's just as hard for us to send patients to a different provider at a different hospital. Even though it's within the WellStar system, we know they're going to be taken great care of. But it's just as hard for us to send them as it is for most of them to leave us, because you develop a relationship, again, especially when we're the only people that deliver at the hospital. We are kind of, my partners are the face of the community when it comes to OB. And so, we develop a special bond with our patients that's unlike any other specialty and unlike most other hospitals, just because we are small and we're a tight-knit community. And so I know for a fact that our patients, I actually saw one a couple weeks ago and told her, listen, your due date's after April. You get to stay with me the entire time. And I was kind of waiting for something good to come of that, and she was so excited. So I'm like, whew, thank God. But yeah, no, she was really excited.
And that prenatal component is critical, and that allows you to take care of the patients from that prenatal to postnatal.
Yes, ma'am.
I like that. That's really huge, and then allows the baby to a NICU team. Can you talk about your team, your NICU team?
Yes, ma'am. We'll have 24/7, a 24/7 NICU team, and it'll consist of both physicians and nurse practitioners, and that will allow us, and is what is allowing us to have that level 2 NICU and avoid the potential transfer of babies to a different hospital.
And it's my understanding as well that we deliver about 40 babies now here in Douglas County on a monthly basis.
Yes,
now, and I
ma'am.
believe it'll double now, 80 babies.
Should. That's our hope.
Is that what you're expecting?
That's our hope, yes, ma'am. I mean, since I've been here over the last year, we've progressively increased our averages, every month, and I fully anticipate seeing, at least, 60 to 80 over the next couple of years, and hopefully it'll just continue to grow.
Continue to grow.
Mhm.
Talk about, is it such things still, they used to call it the Lamaze classes. Is
Yes,
that what
ma'am.
we call it still? Tell me a little bit about that. I'm rusty. My baby's 34, so can you talk about that process? Is
Yeah.
that still something that's
It is. It is. We actually our
Available today?
women's center will offer prenatal classes.
Mhm.
We have lactation consultants as well, both in our office and at the hospital. And again, it's you get such a personalized style of care and birthing experience at our hospital from beginning to end, and that includes the postpartum period when you need anything from the prenatal classes to the postpartum lactation consultants. And the amazing thing is that they're always available any time of day or night, and they're always willing to help.
donor milk? You mentioned that earlier today, and that was something new. We were at a presentation together
Yes,
in
ma'am.
the chamber today. Can you elaborate a little more about that new program? It's called Donor Milk Program. Is that what
Yes,
it's
ma'am.
called?
Yeah, and that's another thing that's becoming more popular throughout different hospitals. But basically allows women who are producing an excessive amount of breast milk to, after properly screened, they can drop their milk off to allow babies. So for patients who aren't comfortable giving their babies formula to start with, or at baby-friendly designated hospitals like what we're trying to become, we really push for the breastfeeding just because of all the long-term and short-term benefits that it bestows on the babies. So it'll allow mothers to, if they're not producing, or if there's a situation where they can't breastfeed, where they're receiving a certain medication or not, then they can give that donor breast milk to their babies.
Yeah, because some of your high-risk mothers may not be able to breastfeed
Yes,
because
ma'am.
if they have pre-eclampsia, high blood pressure, and they're taking type of certain medications.
Certain medications, yes,
just
ma'am.
won't allow you. And I was one of those. That's why I'm checking all the boxes today, Dr. Ward. So
Yes, ma'am.
now it's called donor milk.
Yes, ma'am.
Okay. What advice would you give expectant mothers and who are in early stages of pregnancy? Would you have any advice for these mothers?
Yeah, I think that it's imperative that you start your prenatal care early.
Mm-hmm.
It doesn't. We'll see you at any gestational age,
Yeah.
but it's imperative. That way you get to know us, we get to know you, and we can put you on the path needed to a successful delivery as possible. I always encourage patients who don't know us, our clinic, to come tour the clinic, come tour the new Women's Center or the current unit that we have now. And I think most importantly is just give us a chance. I can pretty much guarantee anybody, any woman that comes or expectant mother to our clinic, she won't want to leave. And I'm confident in saying that. It's because of the people, my team. I would like to think I have something to do with that, but it's everybody from the people who welcome you through the door to to our nurses in the back, to our other physicians, our nurses in our women's center. It is truly something special that until you experience it yourself, it's hard to put into words.
That is so amazing, Dr. Ward. I'm so excited. Are you planning tours for the citizens, the Board of Commissioners? We were really excited about this, the opening of the clinic. So you have tours planned for, I know it's planned for April.
Yes, ma'am.
Which is the spring. It's always safe to say spring.
Right.
In case there's some delays. Are you planning tours, or can you tell us a little bit about the ribbon cutting?
So I believe the 15th of April is a Monday. So the Thursday before we open, we're planning a big opening ceremony. But again, we are in April. April the 1st is April Fool's, so hopefully everything does come to fruition. We do open on time, which everything's moving along rapidly. But we are planning a big opening ceremony. And then after that point, people can go take tours anytime after that point. Once it's officially open, people being patients, families, stuff like that. We offer. The way we usually do it is just we'll call labor and delivery and say there's a patient that would like to come up for a tour, and they say send them on over. So it's again, there's not specific days that sometimes we try to make it specific days, but we're very accommodating for our patients and willing to go above and beyond for whatever makes it easier for them.
And you're accommodating not only to the patient, or should I say the mother and the baby, but the fathers as well. They can actually spend the night. Can you talk about their experience, the father's experience?
Yeah, yes ma'am. No, so with the new Women's Center, we'll have a chair that reclines, which is what I slept on when my wife was there. And I don't know if it was my age or what, but the back started hurting after about the second day. But the new Women's Center will not only have that, but it'll also have a couch area that is multimodal, meaning it can transform into a couple chairs with a table in the middle, but it can also form into like a mini futon type bed. So it'll provide that extra little bit of comfort to make things a little easier on the new families.
Wow, that sounds soothing. Can you describe the relationship between North Douglas, which is your practice, and WellStar? Can you talk about that relationship that you all have?
Yes, ma'am. Yeah. So we're part of the WellStar Medical Group, obviously a very large group consisting of many specialties, all specialties. And so, with that, we have such a network of other obstetricians and gynecologists within that network that we can bounce ideas off or ask questions to. It doesn't happen often, but they're always there if we need them. Now, regarding the hospital, being that we're the only clinic that's around that delivers at the hospital, our relationship to the hospital is probably different than most, just because it's just us. When it comes to delivering babies at our hospital, but a lot of our nurses in our clinic, a lot of the nurses that'll be in our Women's Center, they've been at the same hospital in the WellStar system for 20, 30 years. So we have a solid team to the point that we're more than just a team. We're unified, we're a family, and we practice similar, and it helps provide a balanced and again, family-oriented, personalized birthing experience for all of our patients.
Now let's shift gears a little bit and move to the operating room, which would be your operating room within this birthing center.
Yes, ma'am.
That's my first love, and spent a significant amount of time in the operating room working alongside surgeons, delivering C-sections and what have you. I've delivered twins and triplets and so on and so forth. Tell me about that experience for the C-section mother, and I am a C-section mother.
Yes, ma'am.
So, our experience is a little different than just the birthing.
It is.
The recovery piece, are they allowed to stay? And I'll let you take it from there.
Yes,
Tell me
ma'am,
a little
absolutely.
bit about your mothers.
So, right now our C-sections are done in the main OR, so on a different floor. The new Women's Center will have a dedicated OR on the unit that's just for our mothers.
Right.
So that makes things a lot easier if they were to need a very quick C-section.
Yes.
But it also allows them to stay on the unit to where they're comfortable, where they've maybe been laboring, where they've been before. And they will be allowed to recover on our floor. They won't be in a different area of the hospital. And it'll also allow us to keep mother and baby side by side as long as possible, and instead of separating them to bring the baby up to the nursery from the main OR.
So recovery, you have a PACU upstairs as well with the OR?
It'll be like a transitional recovery room. We're in the process of, they may actually get to go back to the room that they were initially, the suite that they were in. It's just a little different type of monitoring for maybe an hour or two after.
Okay, and I try to refrain from acronyms, and PACU means, for the audience in Douglas County, is post-anesthesia care unit.
Yes, ma'am.
Yeah, being in healthcare, we use a lot. So me and you have a ball. I'm PACU, you back and forth, but I want to make sure the citizens understand. Yeah. So you said that would be a transition period for the PACU if they go to PACU.
Yeah, it'll all be on the same unit.
That's wonderful.
Yes, ma'am.
And then they recover, and then they in the rooms, and everything is just...
It's right along the same hallway. So it's all familiar faces and familiar area.
Yeah. Okay, and C-sections now are going home a lot quicker than 1 week, I believe 3 days you're home.
Yes, ma'am.
3
days. Yes, ma'am.
3 days, okay. Tell me a a little bit about the other facilities around. Would you still continue to work with Cobb and other well-starred?
Absolutely, yes, ma'am. In fact, a lot of our babies that do get transferred wind up going to Cobb because it's closer and they have a high-level NICU there. And I say a lot of our babies. It's very rare that we have to transfer a baby out. We have such a strong pediatric team now. But if it, they also understand when a baby needs to be transferred, and so that's usually when we utilize Cobb or Kennestone. A lot of it depends too on where they can get the baby in, and whether Cobb is is completely booked or not booked, but they've reached their max capacity, and they may have to go to Kennestone. But it's and patients too. If we have to transfer a patient because she's a little too high risk,
right.
Then at that point we would call our colleagues at usually it's Cobb Hospital just because it's closer, and they've always been excellent at accepting our patients. I mean, I can't thank them enough for all the help that they provide for us. And so, but moving into the future, starting April, it's far and few between that'll ever have to happen again. So.
Right. And we call that the interdisciplinary approach. I
Yes,
believe.
ma'am.
The interdisciplinary approach is what we called it in healthcare. So that is so amazing. I'm excited about the quality of care, the enhancements that we will have here in Douglas County for our citizens. And I know the mothers, the ones who are expecting and the ones who will expect in the future, are excited about not taking that long road to Atlanta, the
Right.
drive, because the time is of the essence when you're delivering.
Correct.
And they're right here. So we have the care, and we have very polished and competent doctors like yourself. And this is an honor for us. I can't express how excited that I am and the Board of Commissioners are about this opportunity for our citizens here in Douglas County. Anything else you want to add about what's, the center? I'm so proud of
it's just
everything.
it's an honor to be a part of it. I kind of came in at the end of it, so as much as I would like to take credit for it, I just get to again reap the benefits of what other people have sown. And we have such a strong team. It truly is. If patients are looking for that more personalized birthing experience, the quality of care provided, it's not going to be any different because the quality has always been there and it always will be. It's now we can offer more amenities and a more personalized birthing experience. But there's a couple things, patients, they can trust that when they come to our clinic and our hospital that they are getting the best of what medicine has to offer from our group and our staff at the hospital. And that's important. You would think a smaller suburb of the greater Atlanta area, like, well, shouldn't we be going, what do y'all have to offer that other places don't? And now those people are going to be looking at us and saying, well, they can do this. Well, we don't even do that, here in Atlanta. So Douglas they're getting something special, and it's been because of the work of a strong team.
And you talked about radiology services available for babies. I believe I heard something for the babies as
Yes,
well.
ma'am.
So
There'll be some additional radiologic imaging as
okay.
well as respiratory services as well.
Respiratory, right. So you have a team ready to go.
A whole team, yes, ma'am.
Oh, that's going to be amazing. You mentioned, I don't know her name, you call her the boss lady. That's going to run the unit. Talk about her a little bit.
Miss Trinette Dunbar. She's our Women's Center Labor and Delivery unit manager, and she is the most hardworking, one of the most hardworking people and sincere and generous people I've ever had the pleasure of working with.
Wow. Amazing.
I do call her the boss lady, but she'll never, she doesn't, you don't ever feel that way. Yeah. She leads by example, and we are fortunate to have her as our lead up there, because she is truly one of a kind.
I am so excited about seeing the finished product and all the great things, and would come one day and just visit and say hello, and if y'all needed me to step out and scrub in on something, I'm just teasing. I would love to do so. But Dr. Ward, it's been my pleasure speaking with you today in Douglas County again, the entire county. We're excited about what WellStar is doing here. and I appreciate you and your tremendous team efforts and what you all are getting ready to, I call roll out in Douglas County, something we've
ma'am.
never had. It's been 40 years on the horizon. I looked at the history of how long we've been waiting on this opportunity in Douglas County, and I'm humbled, and I mean that as the chairman of this Board of Commissioners. So again, thank you so much for coming in and speaking with me today.
Yes, ma'am.
And
Thank you for the
take
opportunity.
care of your new baby and
Absolutely.
and your wife.
He's
I
got the
know.
best mom in the world, so
Oh, okay.
I can't take too much credit for it.
Well,
But thank you. It's
congratulations.
an honor. Thank you for all the work you've done as well.
Thank you.